All of these updates coming as we learn more about different health issues connected to COVID-19. 41 Action News reporter Mackenzie Nelson talked to KDHE Secretary Dr. Lee Norman about the medical concerns that athletes in particular face.
As some school districts are moving forward with fall sports, it's not just COVID-19 that health experts are concerned about. It's the long-term effects and other medical uncertainties.
Even young people are not immune to this.
Reports this week linked COVID-19 and myocarditis, an inflammation of the heart muscle that reduces the heart's ability to pump blood and can be deadly if not addressed.
It can not only affect the ability of the heart to pump effectively, but it also can affect the conduction system, meaning the electrical conduction through the heart. So it can cause life-threatening cardiac rhythm disturbances.
Dr. Lee Norman says it's not just COVID-19 that causes this.
If normal viruses like adenovirus or influenza and others cause myocarditis, maybe 1% or 2% of the total number of cases. And I think it's going to be a double-digit number in COVID-19, at least judging on the early things we're seeing coming out of reports.
This week, Penn State's director of athletic medicine said that around 1/3 of Big Ten athletes that tested positive for COVID-19 may have myocarditis. He later corrected those numbers to around 15%. Despite the confusion, Dr. Norman says the numbers are still alarming.
Even a fairly small percentage, even if it were 3 to 5% of a very large number, is a very large number.
For mild cases of coronavirus in athletes specifically, Dr. Norman suspects they would be monitored and gradually get back into activity. For moderate to severe cases, physicians would do more testing. Dr. Norman says before returning to play, he encourages all athletes to be checked.
Even if a person was infected with the COVID-19, whether asymptomatic or mildly symptomatic, I think touching base with their physician or a sports medicine doctor would be a very smart thing to do, because a lot of times athletes aren't very forthcoming, to be honest with you. They'll minimize their symptoms and because they want to get back in the game.
Mackenzie Nelson, 41 Action News.